Feel like I've had a bowel movement but nothing in toilet. No pain, feels like a normal bowel movement, but where is it?
Hi, I'm Dr. Robert, a medical internist, MD, who deals with diseases of all organ systems. All my education has been completed in the U.S. The views expressed here are for educational purposes only and do not establish a physician-patient relationship. It is not intended to replace your own physician's advice or diagnosis. If this is an emergency, stop now and please call 911 or go to the nearest emergency room. Are you there? If so, now is the time to chime in so we can chat. It's not there if you can't see it, so where is it? Two possibilities. 1. You have passed gas, which evacuated the bowel of what was causing the distension that triggers your brain into thinking it's time for a bowel movement. 2. You have a fecal impaction and it is blocking stool from exiting. The other possibility is that you just don't see it because it sank into the collecting channel of the toilet out of view. Those are the options. If this persists, you need a digital rectal exam, DRE, from the primary care physician, PCP, to check for retained stool in the rectum. If you like my answer, please click accept so that I may receive payment for assisting you today. It would be most appreciated. Bonuses are also welcome. Positive feedback is free for you to leave about our session today. It is very important for me to get feedback so I can help customers the best way possible. This is very different than an office setting where I can see if you're satisfied with our discussion. Please consider taking 1 minute to fill this out. Thank you. If you have any questions about what I wrote, please write back for clarification. I'm happy to continue working with you toward a resolution. What happens now? Your chat has ended, but you can still work with your expert to get an answer to your question if you have not yet received one. Come back to this page at any time to see additional information from your expert. You will also receive an email when your question is updated. If you want to send a message to your expert, use the box below.
This happens every few months. Should this be a concern?
No. None at all. You may wish to take Colace, a stool softener, every day. It is sold as a generic docosate sodium. Non-addictive, not absorbed, perfect stool softener. Great to prevent straining when on the toilet, and decreases the risk of hemorrhoids to boot. Great drug. I had all my heart patients on it to reduce straining, which kills people on the toilet, no kidding. If you notice stool on the toilet paper, or hear the stool drop into the bowl, you can be sure you had a bowel movement. This is how I get compensated for assisting you with your medical issue today. Bonuses are also welcome. If you have any follow-up questions about the issue we recently discussed on JustAnswer.com, or any new items that may have come up as a result of my recommendations, please return to our original thread, see link below, and add a new post at the end. I'll get an email notifying me that you want more assistance. It's best to have the first line of your next post state for Coachrobmd only so other experts won't become involved. If I don't hear back from you, hopefully everything turned out well. If you recall, your question related to the mysterious missing bowel movement. Go here to post your response, click reply, and I'll get an email notifying me you want to hear back from me. http://www.justanswer.com/medical/6s48j feel I've a bowel movement nothing toilet.html.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.